coming into the House again today. Last Thursday I spoke at length on reasons why I would support and propose the support of this bill, which I think we've all agreed that it has cross-party support. And I don't intend today to repeat myself, but instead I would like to mention, as Senator Mooney has, about the report from the World Health Organization, which coincidentally was published on the same day last Thursday as we spoke about it in the House. And in that report, it highly recommends the use of the graphic descriptions, which, as we said, and which, as I said last week, a picture speaks 1,000 words, and we all know how effective the photographs have been in the road traffic acts or ads that have been on television lately. The report is the third in a series of the WHO reports on the status of global tobacco control policy implementation, and it examines in detail the two primary strategies to provide health warnings: the labels on the tobacco product packaging and the anti-tobacco mass media campaigns. It is an excellent report which provides a comprehensive overview of the evidence base for warning people about the harms of tobacco use, as well as country-specific information on the status of these measures. The report continues that more than 1 billion people in 19 countries are now covered by the laws requiring large graphic health warnings on packages, nearly double the number of 2 years ago, when only about 547 million people were covered in 16 countries. The latest countries to add it are Mexico, Peru and the United States. These have become the latest countries to add that require the large graphic warnings, and have proven to motivate people to stop either using tobacco or to reduce the appeal for people to initiate smoking at all. This year, the tobacco epidemic will kill almost 6 million people. More than 5 million of them will be users and ex-users of smoke and smokeless tobacco, and more than 600,000 will be non-smokers who are exposed to tobacco smoke. Bringing up again the point that Senator Crown rose about passive smoking and the number of people who are affected by passive smoking. By 2030, tobacco could kill up to 8 million people a year. Tobacco use is one of the biggest contributors to the non-communicable disease epidemic, which includes heart disease, cancers, emphysema, and accounts for 63% of all deaths. Of the world's more than 1 billion tobacco smokers, more than 80% live in low and middle income countries, and up to half will eventually die of a tobacco-related disease. The WHO report recommends the 6 measures, which Senator Mooney has also referred to. Number 1 being the large graphic health warnings, which is exactly what we're proposing here and what I'm commenting on. Also the importance of monitoring tobacco use, protecting people from tobacco smoke, helping the users to quit, reinforcing bans on tobacco advertising, promotion and sponsorship, and raising the taxes, which was another issue that we mentioned last Thursday as well. In conclusion, more than half the world's population, or 3.8 billion people, are now covered by at least one of the above mentioned demand reduction measures. There have been gains in each area because of the effective action taken by countries in 2009 and 2010. The WHO report confirms that large graphic health warnings of the sort introduced by Uruguay, Canada and a handful of other countries are an effective means of reducing the appeal of tobacco. Australia, as we've already mentioned, have proposed legislation to require that tobacco be sold in plain packaging in order to appear less tempting, which will also ensure that fewer people will fall into the trap of smoking. And just today, earlier, I read also where Iceland are now proposing to bring in legislation in the near future which will require a doctor's prescription to enable to purchase cigarettes. So, in conclusion, thank you, Carla.